A look into a month-long GBH News investigation into botched surgeries on some of the most vulnerable patients in the state. A doctor former colleagues and patients believe is dangerous, and the systems other physicians believe are failing to protect patients. People come from across the country to come to some of Boston's world-famous hospitals like Mass General and Boston Children's, but the lesser-known Shattuck Hospital in Jamaica Plain, that's a state-run facility, cares primarily for people who are homeless, people struggling with mental illness, and people incarcerated in the state's prisons. Doctors who work there have described a sense of mission in their work. But as GBH News' deputy investigative editor, Jennifer McKim, found, some of Shattuck's doctors are better than others, and former colleagues and patients have raised the alarm about one surgeon in particular who they argue has done more harm than good.
I know she was negligent. I know she committed malpractice. I know it. She did a surgery she had no right to do, which resulted in the altering of my entire life. In 2016, I got sent to the Shattuck to see Dr. Carrillo from Sousa Baranowski Correctional Center. I was in prison from November of 2012 until January of 2023. I broke my foot and I did need medical care. Dr. Carrillo explained an easy, relatively painless surgery to me. He said I'd be walking out of the hospital that day and I'd be back to full recovery in a week. When I woke up, I was in so much pain. I told the bedside nurse, like, hey, something's not right. I'm in a lot of pain, like a lot of pain. My foot felt like it was burning, like it was on fire. Like I felt like my head was gonna pop off. I wasn't walking out of there. They knew I wasn't walking out of there. I got put in a wheelchair and wheeled out of there, and I left.
I first heard from one advocate who works with people in the prisons that, you should really look into this orthopedic surgeon at the Shattuck because there's a lot of complaints about her. Adriana Carrillo is an orthopedic surgeon. She is a long-time surgeon at the hospital. We started to look up court records, and we found 20 cases from prisoners in state and federal courts related to botched surgeries, deliberate indifference. People are saying they go in there and they come out worse.
So we found 20 cases. What you're saying is that there's likely many more people out there.
Definitely. Many more.
I spoke to several doctors who used to work at the Shattuck.
I felt in almost every interaction I had with her that her care was dangerous, not based in guidelines, and almost every patient I spoke to, there was a report that she was dismissive and showed absolutely no compassion.
So we went down to visit Matt. He says that he went in there understanding he was going to have one surgery. He got another one he hadn't given consent to and was never told about for months until months later, and when he read his own reports and realized what had happened to him.
This is the medical records right here. So this is how the dressing was.
She didn't ask you for permission?
She didn't ask me, tell me, or anything, nothing. Not even when I woke up, she told me I was being a baby. The way she explained it was gonna be a little cut like this on the top of my joint that goes this way. Instead, I ended up with the cut like that long that went this way, all along like my whole inside of my right foot. You could see there's lines like three of them, lines like that where the sutures ripped through and just went and just like opened right back up. My foot got infected. It was splitting open.
And he also claims he begged and begged for care. He didn't get even basic courtesies like clean bandages when he went to the hospital and begged and asked for them. Found himself with an incredible infection in his foot that he couldn't get help with for months. And he said both the prison system and the doctor really didn't pay attention to him until he had to have another surgery to treat the infection.
It was like I was an animal. I honestly, an animal would literally get treated better than I did. My foot hurts all the time. My whole body's twisted. I have herniated discs in my back, so now random parts of my leg go numb. I don't think I will ever be pain-free in my life again.
What do you think about the fact she's still there?
I think it's incredibly unethical. I think it's a travesty in medical care.
Folks wrote a letter to the head of the Department of Public Health, CC'd the governor at the time. Did you feel like you were heard at all?
I don't think at all. There was really no action that shows that someone is taking our complaint seriously. And that's what makes you frustrated, and this is how you lose trust in the system.
I want to explain that Dr. Carrillo has never lost a case. The vast majority of these cases are won by doctors. And these medical malpractice lawsuits, I've read through these court records, and so many of them are begging for a pro bono attorney, begging for some state funding or federal funding for an expert. And that was Matthew Tottenham's case. He was filing his lawsuit from his prison cell. His case was dismissed in state court, and he is now filing an appeal.
This is just a motion to oppose. I'm just hoping that on some level she's held accountable. She just can't do this to people and just walk away scot-free, you know?
GBH News' deputy investigative editor, Jennifer McKim, joins me now, as do the two former Shattuck physicians that we just saw in that piece, Doctors Katrina Armstrong and Salah Al-Rakawi. Thank you so much for joining me.
Thank you for having us.
Jennifer, I wanted to start with you. You probably have been approached many times with stories like this, medical misconduct, and then we often hear sometimes from prisoners who are saying this is their case. What really stood out to you when you started to get perhaps phone calls or messages and being told about what's happening here at Shattuck?
Well, I've covered the prison system for a long time, and I've always been really interested in the Shattuck Hospital because it does care for the poorest state patients that we have. And I've heard often that it's a place that prisoners complain about a lot, that they don't feel treated well. So when I heard from an advocate who said, you really should check on this one particular doctor because there's all these complaints about her, I really wanted to look into it. And then we found 20 lawsuits, which is, from what I understand, a lot of lawsuits for one particular physician to face.
Dr. Armstrong, when did the alarm bell start to ring for you?
Well, I'd like to first step back and thank Jennifer McKim for reaching out to me. She reached out to me actually over a year ago. And to be honest, I had been hesitant to agree to speak, certainly on the record, partly because my concerns about the Shattuck were, yes, about patient care under Dr. Carrillo's care, but much larger issues, which is what I experienced when I worked at the Shattuck for almost 10 years. The reason why I did agree to finally speak out was because I'm continuing to see both community incarcerated patients that continue to have complaints about the care that Dr. Carrillo has been delivering, the devastation secondary to the surgeries that she's done, and the negative interpersonal interactions. That, coupled with the fact that I really would like to talk about the fact that this lack of oversight is really a tip of the iceberg to what I experienced at the Shattuck when I worked there and continue to see in the patients that I continue to care for.
Well, talk to me about that then. You said you experienced some things that really obviously made you concerned enough to come forward as a physician, and I know that that wasn't a easy decision for you. So talk to me about was there a defining moment? Was there a particular case that stood out to you?
Overall, the lack of oversight, the lack of safety, the lack of transparency in the Shattuck had led to cases that I had seen that I would report that I had concerns about. I did have a concern about one particular case before I left, which was emblematic of other cases where a patient was receiving surgery under Dr. Carrillo. She had operated on the wrong limb. The patient was quite distraught after that, and as an infectious disease doctor at the Shattuck, I received an immediate urgent consult. This consult was from the patient that had the operation done on the wrong limb, and he wanted to have his immediate hepatitis C treatment, and so I was asked to do an immediate consult. That was shocking to me and very concerning. This patient was an incarcerated patient. Other areas and examples of concern are continuing. I would have patients continuing to talk about that care, but more importantly, the lack of oversight for Dr. Carrillo, the lack of the administration answering concerns that I would have and other doctors would have about safety, about oversight, about transparency were very upsetting, and it prompted me to ultimately, in conjunction with experiencing my own toxicity in the workplace violence directed to me from the prior COO, Chief Operating Officer, witnessing coworkers, CEO, and witnessing sexual misconduct towards coworkers by that same person, reporting all of these with other clinicians, prompted me to fear for my own safety in the workplace, and now has prompted me to really want to speak out, not only to improve patient care, patient safety and oversight, but improve the support for the current clinicians that are there, that are working incredibly hard, that work every day and have fought every day to give the best possible care to their patients. They remain. So I hope that this is an opportunity to have that oversight, that transparency, and improved safety at the Shattuck.
Yeah, Dr. Al-Raqqawi, I would ask, you are nodding your head at everything that Dr. Armstrong is talking about.
Yes.
You experienced, the aftermath of what Dr. Carrillo is alleged to have done.
So I didn't have really like a direct relationship as Dr. Armstrong seeing patient Dr. Carrillo, but I've heard a few cases from the infectious disease division, not only from Dr. Armstrong, but from other doctors. But I mean, to think systematically and not talking about an individual, what we need to focus on is the system that made this happen and continue to allow this to happen. A system where we have a disparity of care to vulnerable patient population, mainly to prisoners, to mental health patients, to people who are underinsured, undocumented. Those people are not getting the standard of care within the city of Boston in certain fields of medicine. I know the hospital is under-resourced, and I know there's a lot of pressure there, and I know people are trying to do their best, but I think we need to continue to advocate for those patients. What worries me is, like, anytime we try to speak up and advocate for the patient and talk about patient safety, recently during our time there, you start worried about retaliation. And retaliation doesn't happen directly, but it's indirect retaliation. But we've witnessed over the past 3 or 4 years of my journey at the Shattuck, a very toxic environment where you really paralyze you as a physician to act. I mean, if you're going to go to a place that is very toxic, that people are watching everything you say, that they are misinterpreting what you say, and you have to be careful with what you say, that's really you won't be able to function and continue to deliver. when you are witnessing a misconduct by a person who's supposed to be a role model for everyone in the hospital, mainly the CEO, then who's practicing workplace violence in a state where every year we have to review the workplace violence and attest to it. And I'm not talking about one occasion, because all of us at some point in a momentary age we might see something. But we have a pattern of workplace violence, and then you report it to the state and no action is taken. When you see this person is conducting a professional misconduct, when you see this person with, at least that I know from the people I talk to, of sexual misconduct, making sexual comments that really made people uncomfortable, and then you report to the state, they will make an investigation, and the person who will find finding of some sexual misconduct will get fired, and then come up with another investigator who will basically come up with a report saying there's no evidence of that. That would make you at some point say, you know what, after spending 23 years in the hospital, probably it's not the place for me to work at anymore. Because you try to advocate for patient safety, but we are paying the price.
Yeah. Jennifer, I read that there are other claims or allegations against Dr. Carrillo, but some of those didn't get over the finish line because attorneys weren't available for some of these folks, or they couldn't produce the evidence that would be necessary for that.
Right, so there were 20 lawsuits, and none of them has resulted in any wrongdoing found by the doctor. But they're very challenging to file, to run for people who don't have lawyers, who don't have resources. Medical malpractice, you need experts. So there's a lot of reasons. But so we talked to not only those 20 people or some of those folks who have filed those suits, but people who are in prison now, probably watching right now, who have similar complaints. So that the numbers are much bigger. I'd also like to say that I didn't investigate some of the allegations that we're hearing now of sexual misconduct and other things. I did speak to the state, and the state said we did investigate and resolve the issues, and that the former CEO resigned on his own will. So I just want to say that there are those feelings. My understanding is that these doctors, when they heard that was the moment when they said, we want to come talk because we don't think that's right. And we want to open it up and shine a spotlight into something where they felt like there wasn't a true look at what was happening in this hospital.
Yeah, in reading your report, it says that the Massachusetts Department of Public Health said we don't have anything on her in this.
They also said that they didn't have any formal patient complaints, which was confusing to me. And I said, well, that doesn't count medical malpractice lawsuits? And I guess not. So that is unusual for me, actually, just as a person. It seems like semantics.
As an investigator,
Right, it seems like semantics. But
I imagine folks at home are, like, that's incredible to even hear when I read it. And I imagine that folks at home must be shocked to hear that as well.
So I think,
if I may say something, we are patients' voice. We are dealing with patients. Half of the hospital is under the Department of Mental Health. Unfortunately, those patients cannot advocate for themselves. They don't know any better. You don't expect those patients to file and report and this and that. We are the one who, when you see something wrong, we are obligated to report it. When you see a patient mistreated or undertreated, or when you see that a non-clinical person making clinical decision and overriding the expert, the doctor's expert in the hospital by making some impulsive medical decision, we have the obligation to speak out. I'm really surprised that they don't have complaints from the prison part of it. But back to the investigation. Yes, there was investigation done, but all those investigations, I think they had the outcome of the investigation prior to the investigation being done. And we haven't seen anything. We were told that there will be a new chief medical officer who's like a great person who came to us from one of the best hospitals in Boston. Her specialty was quality of care and patient safety. That person couldn't survive in the hospital more than 2 months and had to leave the hospital because the way they were treated and what she's seen in the hospital. This tells you how big is the problem that's happening in a state hospital under the Department of Public Health. We've complained through the system. We went to the commissioner, to the Secretary of Health, to the governor. We were hoping, we were desperate to talk to someone to address those issues in a transparent way, and that didn't happen.
And now you all are calling for a state investigation.
Definitely,
Yeah.
definitely. I mean, if we can have anyone, I'm willing to sit on one-on-one with anyone from the PH, whether from the current administration or from the previous administration. We need to look, if we don't learn from our mistakes, we're not going to do any better. Talking to people who are still working there, they are telling me that the place is much, much worse than when you left. So imagine those patients, how they're being treated there. They're understaffed, under-resourced, and whoever left there, unfortunately, the people who end up leaving there are the people who get basically by supporting what's happening or looking the other way, they got rewarded by handing them a state job or a state position or putting an ad for a state position to suit someone's own CV. I mean, we have an ad for a chief of medicine that was placed and saying that someone with an oncology background is recommended to apply for this position in a hospital that is all addiction medicine and infectious disease. Why would you ask for the chief of medicine to have an oncology background just because there's a person who was helping them out during this, whatever done, to just reward that person?
Yeah, there's so much more to uncover here. Unfortunately, we're out of time, and I apologize for that. But you know, the time goes by quickly, and I'm sure you're going to continue to work on this story.
Absolutely.
I hope.
Yeah,
I hope. I mean,
for
there's
sure.
a lot to uncover. We have a lot of specifics. We have a lot of letter. We have a lot of witnesses, and we've been desperate to talk about what's happening in the DPH system.
And to support
Yeah.
the patients that are continuing to get care there from the hospital, but to support the current clinicians that are working so hard, and that by speaking out for increased transparency, safety, and oversight, they fear retaliation, as I did,
Yeah.
as Dr. Alrakawi did,
Exactly,
as
yeah.
all of us did.
Yeah. And we all paid the price for speaking up.
Absolutely. Well, I want to thank you for your time.
Thank you.
Jennifer McKim, Katrina Armstrong, and Salah Al-Rakawi. Thank you so much for your time.
Thank you for having
you.
us. Thanks.